Rika Guevara, and this video covers the peripheral vascular system. So first is I am going to introduce myself to my patient and also verify his identity. So good morning, sir. I am Rika Guevara, your student nurse for today, and I will be going to assess you. So for verification, may I know what is your name?
I am Jasindip Singh Isekhon,
Okay, and when is your birthday?
February 5, 2009.
Okay, so for today, I am going to assess your peripheral vascular system or yung arms and legs nyo po is i-check ko. So may times po na hahawakan ko po ito. Okay lang po ba yun sa inyo?
Good lang po.
Okay po, then and for your privacy, no need to worry po kasi confidential lang po ito sa akin and sa attending physician nyo po. So shall we start na po?
Apo.
Next is I will be collecting the subjective data of my patient. So, do you experience any skin changes in color, temperature, or texture?
Wala po.
Leg pain, heaviness, or masakit po ba yung legs nyo?
Wala po.
Leg veins, mayroon po ba kayong contorted or bulging na veins? Or
Wala
ugat?
po.
Wala. Leg sores, open wounds, may sugat po ba kayo ngayon?
Wala po.
Swelling ng pamamaga?
Wala po.
Okay. Then, I already wash my hands and provide privacy for my client. And now, we will be proceeding on assessing the arms or the upper extremities. So, I already positioned my client in a supine position to fully check his peripheral vascular system. First is, I will be inspecting bilaterally the arms of my patient for its size, the presence of edema, if it's swelling, or signs of masses. So, position your arms like this. Okay, so baba na po. So, upon assessing, I observe naman na there is no swelling or ulcers or sugat sa inyong kamay and pantay naman yung skin color nyo and wala rin ako nakitang presence of edema. So, next na po tayo. Next is, I will be inspecting bilaterally for the skin color. Okay. So, I inspect na pantay naman yung both arms nyo ng skin color, even siya. Okay. The next is, I will be inspecting for the clubbing of his nails. And I see that there is no signs of clubbing of his nails and it is normal. Then I will check for the temperature of his both arms using the dorsum or the back of my hand. Okay, so as I inspect, his both arms is even in temperature, they are warm and it is normal. Next is I will be determining the capillary refill time of my patient. Okay, so as I observe, your capillary refill time is normal. Bumabalik siya sa dati niyang kulay within 2 seconds. The next is, I will be palpating the radial, ulnar, and brachial pulse of my patient. First is the radial pulse, which is, it is aligned on my thumb finger. Okay, both hands. Okay. So, your radial pulse is normal, which is, it is 2+, and the rhythm is regular. Next is the ulnar, which is, it is aligned on my pinky finger. Okay, so as I observe, your ulnar pulse is 2+, and it is normal. Its rhythm is regular. Next is the brachial pulse. As I observe, it is 2 plus and it is normal, and the rhythm is regular. We will proceed on palpating the epitrochlear lymph nodes of my patient. This one muna. The next. Okay, and we're done. Next is I will be performing the Allen test to my patient. Then we will proceed. Okay, so close your arms tightly. Open, and I will release. Okay, so I observe the pink coloration returning back to normal. Next, close your close your hand. Open. Okay, I observed din yung pink coloration, which is normal. Now we are done on assessing the arms. We will proceed on the lower, which is the legs. First is I will inspect bilaterally for the skin color. Okay, so as I observe naman po, pantay po yung kulay ng both legs nyo, which is normal. There is no uneven pigmentation akong nakikita. Next is I will be inspecting for the hair distribution of his hair and also note for the ulcer and lesions on his legs. Okay. So as I observe naman, your hair on your legs po is evenly distributed and wala rin ako nakikitang lesions or open wounds, which is normal naman po. Next is I will be inspecting for the edema. Okay, wala akong nakitang edema or pamamaga, which is normal. Then I will be palpating for the temperature of his leg using the back of my hand. Okay, it is normal, which is it is warm and it is even on the temperature, and that is normal. Then I will determine also his capillary refill time. It is normal, which means that nung pinrest ko yung thumb nyo, nagbalik siya sa normal within 2 seconds. Next is I will be palpating for the pulses. The first pulse is the dorsalis pedis. First is the dorsalis pedis, which is located here. Okay, kabila. Okay. Next is the posterior tibial pulse, which is located here. Okay, next. Okay. For the last one is the popliteal pulse. So slightly flex your knees. Okay. So the popliteal pulse is difficult to detect. Okay, next. Kabila. So, we are done on palpating the pulses. Next is, I will be inspecting for the varicosities and the thrombophlebitis and ask my client to stand up. So, stand up po. Because it is only visible if the client is to stand. Okay. So, as I observe, his veins are flat and it is only slightly visible on the surface of the skin. Okay, so done na. So please sit down. So we are now done on assessing your peripheral vascular system, and upon assessing, I observed that your hair is evenly distributed. The temperature of your both arms and legs is normal, which is it is even also. There are no lesions, ulcers, or sugat na nakita or bukol. And sa capillary refill time, it is normal din po kasi bumabalik sa dating kulay kapag pinipress yung thumb or yung fingernails mo. So the last thing that I will be doing is I will be documenting my patient's data that I collect to my patient upon assessing his peripheral vascular system. And that's the end of the assessment of the peripheral vascular system. Thank you for watching.